At this moment, a shadow has descended over our health. There's an invisible enemy lurking in the air. What if I told you this enemy could be the pandemic of the future? Imagine it spreading all around you, yet most people don't even know it exists. Are you ready to learn a truth that could save your life and the lives of your loved ones? Stay with us, because we're about to unveil this terrifying reality. What is HMPV? HMPV, or human metapneumovirus, is a virus that primarily attacks our respiratory system. First identified in 2001, it has recently come into the spotlight in a deadly way. It particularly affects children, the elderly, and people with weakened immune systems. Imagine suddenly struggling to breathe, battling a high fever, and feeling exhausted all day. Scary, isn't it? But don't worry, this isn't rocket science to protect yourself from. You just need to take some simple precautions. Common symptoms of HMPV infection: cough, fever, sore throat, runny or stuffy nose, body aches, headache. Usually this virus causes mild symptoms, but it can lead to severe respiratory illnesses, especially with these serious signs. Severe symptoms: difficulty breathing, chest pain, persistent coughing, prolonged fever. If you notice any of these severe symptoms, don't delay. Contact your nearest hospital immediately. Did you know who's most at risk? Children and newborns, especially babies aged 6 to 12 months, are the most affected. Elderly people, over 65, those with chronic illnesses, like asthma, diabetes, heart disease, or kidney problems, and anyone with a weakened immune system, they're at higher risk of infection. Imagine missing an important family event just because of this virus. Recently, in January 2025, a major HMPV outbreak has been raging in China, sparking global concern. This virus can cause severe respiratory infections, especially in those with weak immune systems. Symptoms of HMPV typically appear within 3 to 6 days of exposure. Because of this incubation period, an infected person can spread the virus to others before showing symptoms, making it tough to control. According to the Health Directorate, the number of HMPV patients in multiple hospitals in Bangladesh has recently spiked at an alarming rate. Experts warn that if it's not contained, it could spread even more widely in the coming months. Without proper action, this could put new pressure on our healthcare system. Picture this: your family members lying in bed, sick and helpless. In a country like Bangladesh, where healthcare resources are limited, even small illnesses can turn into major crises. How others can get infected: direct contact with an infected person, droplets spreading through the air when an infected person coughs or sneezes. The virus can survive on surfaces for hours. Touching contaminated objects, and then your mouth, nose, or eyes can lead to infection. So, is there no way to prevent it? Of course there is. Simple habits to prevent HMPV. Keep your hands clean. Wash your hands with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer. Protect your respiratory system. Cover your mouth with a tissue or elbow when coughing or sneezing. Wear a mask. Maintain social distance. Stay a safe distance from people with respiratory infections. Avoid crowded places. Clean frequently touched surfaces. Door handles, light switches, mobile phones. Keep them clean and disinfected. Stay home if symptoms appear. Avoid contact with others. Ensure good ventilation in your room by opening windows or use an air purifier. Raise awareness. Educate others about HMPV and alert your community. By doing all this, we can protect ourselves from this virus. Thank viewers for watching. Stay with us for upcoming content. Subscribe, follow to your channel, like the video, comment with their thoughts, visit our social medias.